It's complicated once you have heart disease, but the goal for people should be not to get heart disease. So I've been provided with a list of common heart-related questions, and we're going to go through those questions and my answer for those today. So the first question, how does the heart work? The heart is a pump, has 4 chambers, and its main function, besides being the center of love and affection in the human body, which is probably the most important thing, is to pump blood with oxygen and nutrients throughout the body. What are the best things someone can do for their heart health? Anything that's moving your body is good for your heart. Many of the activities involved in subsistence living are good for your heart, most specifically being physically active, so berry picking, fishing, hunting, non-processed natural foods, even foods that people commonly think of as not being healthy, such as red meat, are actually quite healthy, and they're much healthier than highly processed store-bought foods. Neil Young, Heart of Gold, or Tom Petty, the Heartbreakers? I'm more of a Debbie Harry Heart of Glass fan than a Heart of Gold fan. What are some of the things that increase the risk of heart disease? Cigarette smoking, sedentary lifestyle, eating highly processed foods, fast foods, highly stressful job, some things you can't control like genetics. These are all things that increase the risk of heart diseases such as heart failure or atherosclerotic coronary disease. What should I do if heart disease runs in my family? So that's important, and the main thing about that is let your primary care doctor know that your family has a particular heart problem. Some of them are genetic. If there's, say, a history of early heart disease like heart attacks, they'd want to be more aggressive with blood pressure control, with cholesterol control, with trying to help you avoid smoking or quit smoking. Another question, how does alcohol affect the heart? We deal with this regularly, and it's a very, very important question. Excessive alcohol actually is directly toxic to the myocardium, and if you drink heavily, you can get an alcoholic cardiomyopathy where the heart becomes very, very weak. That is a serious problem in Alaska, and people need to know that excessive alcohol can cause that problem, and that can be a fatal problem. The next question, what advice would you give someone trying to change their lifestyle to reduce their risk for heart disease? Try to stop smoking. There's lots of aids to help you with this. Build physical activity into your daily routine, park far away, climb the stairs, get out and walk on your lunch break. Those are kind of everyday things you can do to move your body. If you're going to start an exercise regimen, just start slowly and progress slowly. So the next question is, any tips on how to fix a broken heart? I'm not a relationship expert, but that seems to be broken heart, meaning a romantic relationship, and exercise can help reduce stress and depression related to that as well. All those healthy activities are far and away the best thing you can do for yourself to maintain good heart health and not have to ever see a cardiologist like myself. But if you do have any concerns about your heart, you should see your health aide or your local provider.